So today we will talk about subcutaneous tissue. Basically, in the skin, we have three layers. One is epidermis, second is dermis. So basically, skin is having two layers: epidermis, upper layer, and second layer is dermis. Below the dermis, anterior to dermis, we have blood vessels, glands, everything related to that. But below the dermis, after the important accessory tissues, we have subcutaneous layer. So this is the after entering into the epidermis, we will enter into dermis. After the entering into epidermis, we will enter into subcutaneous tissue. So this is the subcutaneous tissue. This is the third layer after, as we see, epidermis, dermis, and cutaneous. Okay, let's talk about subcutaneous tissue. Subcutaneous tissue may also be called the superficial fascia. The another name of subcutaneous tissue is superficial fascia. Superficial fascia is also known as subcutaneous tissue. Subcutaneous tissue is also known as superficial fascia. Okay. One of the connective tissue membranes made of areolar connective tissue and adipose tissue. So subcutaneous tissue made up of two types of tissues. One is areolar connective tissue and another is adipose tissue. So basically we talked about that in tissue chapters. Okay, you can refer there. The superficial fascia connects the dermis to the underlying muscles. Its other function are those of tissue, as you may recall from chapter 4. Okay, so basically this is the epidermis, this is the dermis, this is subcutaneous. This is the muscular layer. After the muscular layer we have bones. So basically this is the skin, this is the muscle. So subcutaneous tissue connects both muscles and skin. Okay, that's the thing we have to remember. Areolar connective tissue or loose connective tissue, another name of areolar connective tissue, that loose connective tissue contains a collagen. It have collagen and elastin fibers and many white blood cells that have left capillaries to wander around in the tissue fluid between skin and muscles. So we have what we have? We have in the subcutaneous. This is the short form of subcutaneous, S/C. So what they have? They have collagen, they have elastin fibers, okay, and WBC, which are released from the capillaries. This is the capillary, WBC released. So they are wandering in the subcutaneous tissue. Okay, they will walk, they will observe, is there any problem? They will ask, okay, like police officer. Mast cells are specialized connective tissue cells found in the areolar tissue. They produce histamine, leukotrienes, and other chemicals. So here we have to talk about mast cells. Mast cells are specialized connective tissue. So they are available in subcutaneous layer. So we have WBC. After WBC, we have mast cells. They are connective tissue cells. Okay. So they produce what they produce: histamine, leukotrienes, and other chemicals that help bring about inflammation. Okay. So basically, in the subcutaneous tissue, we have collagen fibers, we have fibrin fibers or elastin fibers, okay, and we have WBC, and we have mast cells. Mast cells produce histamines and leukotrienes and other chemicals. What mast cells produce? Mast cells produce leukotrienes, histamines, and other chemicals. Leukotrienes, histamines, and other chemicals. So why he is releasing these chemicals or everything? Because whenever our body damage, okay, whenever our body damage, likewise, suddenly you are walking on the road, you fell down, okay. What you have? You have some scratches or lacerations or wound on your hand. What the body will do, basically, when you fell down, this is the hand. Basically, okay, this is the hand, your hand, okay. You fell down and you got some wound, laceration. Okay, laceration is also known as wound. Okay, so wound, some piece of skin is scratched. What will body do after? Okay, the body have mast cells. What he have? Mast cells. So whenever your cell damage because of falling down, your cells are damaged. Mainly epidermis, first epidermis, next dermis. If you are fell down very forcefully, then arteries and veins also damaged. Then blood will come out of arteries and vein. Then bleeding occur. Okay, bleeding occur. Okay, so basically the mast cells activate. They what they will do? They will try to eat this damaged cells. They would like to throw away these damaged cells. If they doesn't allow to remove the damaged cells will what will do? They will uh, they will have they will have negative effect on that area. Okay, so that's the reason the mast cells which are present below the subcutaneous tissue, it will attack on the damaged cells. So on this procedure, they have chemicals. Mast cells have what type of chemicals? Histamine, liquid rinse, and other chemicals. Whatever the other chemicals, we will talk in the inflammation topic. So here I would like to explain the basic thing that these mast cells release histamine, liquid rinse, and other chemicals, and on that effect, you will get inflammation on the wound area. So this is the natural process. Gradually, your inflammation will decrease, your pain will decrease, and everything will decrease without taking any medicine. Mostly, okay, mostly because it is a natural healing process. You have to take rest. It will take 48 to 72 hours minimum. You want to, depending upon the forceful fall and how the damage area is in your body. Okay, so this is the thing we have to remember, that during any injury, and you have to explain the patient about the thing. Okay, so all about inflammation we will talk in chapter 10 and 14. Okay, and the second thing we have to remember, that the adipocytes or adipose tissue are specialized store fat, and our subcutaneous layers of fat stores excess nutrition as a potential energy source. This layer also cushions bony prominence, such as when sitting, and provides some isolation from cold. For people, this last function is relatively minor because we do not have thick layer of fat as do animals such as whales and seals, as mentioned in chapter 4. Adipose tissue is involved in the onset of or cessation of eating and the use of insulin by body cells. and it contributes to inflammation by producing cytokines, chemicals that activate white blood cells. So here we have to remember another thing, that in the subcutaneous layer, so basically this is the subcutaneous layer, epidermis, dermis, subcutaneous. In the subcutaneous you have uh, alveolar connective tissue, adipose tissue, WBC, mast cells. Okay, so here we have adipose tissue. What is the adipose tissue? So basically, in the blood, if you have excess of amount of energy, okay, which are not utilizing, that liver convert this energy into fat. Okay, our body store this fat below your the subcutaneous tissue in the adipose tissue. Adipose tissue have fat, and a storage of fat means storage of fat. So basically it is the energy, it is stored in the form of fat. So whenever your energy levels decreases or you doesn't able to take the food, so this energy is utilized in emergency conditions. Okay, so whenever you doesn't eat food, so the body will uh, use this stored fat. Okay, then you're able to decrease your weight. Okay, so that's the reason fasting is very intermittent fasting is very good for fat loss. Okay, next we have to talk about, just as the epidermis forms as continuous continuous sheet that covers the body, the subcutaneous tissue is a continuous layer, that is, it is internal. If we consider the epidermis as the first line of defense against pathogens, we can consider the subcutaneous tissue as second line of defense. Basically, in the epidermis, we have also defensin that will attack on the pathogens, which will take those pathogens to the lymphocytes, and the lymphocyte will attack, and or it will produce antigen to attack to the pathogen. Okay, the cells of the epidermis are very closely and tightly packed. Okay, but the cells and protein fibers of subcutaneous tissue are farther apart, and there is much more tissue fluid. If we imagine the epidermis is as a four-line highway during rush hours with bumper to bumper traffic, the superficial fascia would be the same highway at 3 o'clock in the morning when it is not crowded and cars can move much faster. This is an obvious benefit of the migrating white blood cells, but may become a disadvantage because some bacterial pathogens, once established, can spread even more rapid throughout subcutaneous tissue. So basically here explaining that epidermis have packed cells. Okay, if the pathogen enters, okay, they will not able to enter into the dermis or subcutaneous tissue, and the our immune system responds quickly. Okay, but if it is the subcutaneous tissue, it very not able to it were able to travel. They are not packed cells. Every cell is roaming here and there. So if pathogen enters, it will can easily spread throughout the body. Okay, so we have to remember that. Group A streptococcus, for example. So what is here giving one example of bacteria, that is streptococcus. It is a cause of necrotizing fasciitis. Necrotizing means to cause death. Necrotizing means cause of death. Fasciitis means inflammation of fascia. So superficial fascia have it will die because of facial inflammation. In this case, the superficial fascia and deep fascia around muscles, necrotizing fasciitis is an extremely serious infection and requires surgical removal of the infected tissue or even amputation of an infected limb to try to stop the spread of the bacteria. The body defenses have become overwhelmed because what is usually an anatomic benefit, the looseness of alveolar connective tissue, has been turned against us and become a detriment. The function of the subcutaneous tissue. So basically, here one example is given, that is Streptococcus bacteria. If the Streptococcus bacteria enter into the subcutaneous tissue, what will happen? It will damage the fascia, which is connected both to the subcutaneous and muscles. So basically, if it is not treated, it will also enter into the muscles and it will damage your muscles also. So we have to remember that the it will need maybe amputation. The damage occurs very strongly. It will it will need it will need sorry, surgical removal or maybe anything. Okay. Here we have the diagram. You can see that subcutaneous tissue, areolar connective tissue and adipose tissue. Here we have the administration of medications. Administration of medications. Okay. So basically, this is the intramuscular area. Right. Subcutaneous area. This is the dermis, and this is epidermis. Okay. So basically, most of the injections are given in intramuscular. Some injections are given in subcutaneous tissue. Okay. So and endo dermal patch are attached to the here the dermal patch. It is attached to the epidermis. Some of the injections are giving subcutaneous, that is like insulin. Insulin is given on subcutaneous. Okay. Intramuscular injections are given, and some injections are in the epidermis. So we have vessels like arteries and veins. Okay. What is the aging and integumentary system? Basically, the age of integumentary system are quite visible. Both layer of the skin become thinner and more fragile as mitosis in the epidermis slows and fibroblasts in the dermis die. So when you continue, when the age is going on, what will happen? Mitosis is stopped in the epidermis, and the dermis will die, and not in the fibroblast, dermis will die and not replaced. Okay. And skin become wrinkled because collagen and elastin fibers in the dermis deteriorate. Okay. Sebaceous glands, sweat glands become less active. The skin become dry. Temperature regulation in hot weather becomes more difficult. Okay. Hair follicles inactive, hair on the scalp and body thins. Okay. Melanocyte dies. Okay. Everything will happen during aging. Okay. And your hair become white. There is often less fat in the subcutaneous tissue, which make an elder person more sensitive to cold. So it have very cold environment whenever the older person enter into cold environment. Okay. So basically, this is all about integumentary system. Okay. So whatever you have, you can please kindly summarize everything. Okay. Okay. Who completed our topic integumentary system. So here we have the outline of this chapter. We studied about epidermis. We have two layers. Basically, it is made up of stratified squamous epithelium, and it have stratum germinativum, stratum corneum. It is inner layer, and stratum corneum outer layer, and it have Langer cells, melanocytes. Okay. Next we have dermis. Dermis have it is also made up of irregular fibrous connective tissue. It have collagen, okay, elastin also, okay, which made it very strength, okay, and give very uh, young 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 look. Okay. So in old age these tissues and collagen become very ineffective. That's the reason in old age skin look very uh, means elasticity will out it. Okay. In the dermis we have hair follicles, nail follicles, okay, receptors, sebaceous gland, caromeneous gland. Okay. They have their own function. Apocrine glands also. Okay. Acrine sweat glands, arterioles. Okay. Arterioles, venules also there. In the subcutaneous tissue have areolar tissue, adipose tissue, and mast cells, etc., etc. And subcutaneous tissue is the third layer which connected both skin and muscles. Okay. So here we have the questions. You have to answer it. Then only you will able to understand how much you got into your brain. Okay. So kindly note down these questions, answer it. Okay. And learn something in this chapter. So we have next chapter, that is bone. In the next class, we will start skeletal system. Okay. So we can stop here our class. Thank you.